were discussed in the initial session are an interesting new way of helping to address that, but aren't enough, and we need broad-based solutions. And there was also a timely reminder that in considering the different range of actions that should be taken, we shouldn't be naive about the tactics that are used by some of the different interests involved. And there was a call from participants that the alcohol industry, similarly to the measures already taken in regard to the tobacco industry, shouldn't be part of the solution with respect to Article 5.3 of the WHO FCTC, as that applies also in that area. Overall, I think there was a strong message from that workshop of not losing sight of the importance of these issues and of a strong call for action overall on these important challenges. Down to the last two workshops, colleagues. Then we get to the ministers. On preparedness, I think we heard just from the Commissioner, and we've heard through other speakers, about many ongoing activities on crisis preparedness in Europe and the many steps that have been taken. I think one of the key messages from this workshop was that we're very focused in our post-COVID world on preparedness, in particular in relation to infectious diseases and communicable diseases, but those aren't the only preparedness challenges. And so the presidency started that workshop from the hypothetical scenario of a large flood, for example. And so I think that one of the key messages from the workshop was the importance of taking that broad approach of a polycrisis, a permacrisis approach that I know that Dr. Kluger has talked about. Perhaps being ready to expect the unexpected. And in responding to that, there was a clear consensus that we need a coherent, transparent, and effective European framework for health emergency preparedness and response. Obviously, we've seen through the European Health Union measures several valuable new initiatives, such as the establishment of HERA, the strengthening of the EMA and the ECDC, but unanswered questions still remain. So there was a clear message from the workshop that essentially in a state of crisis, we need to know who is in charge and what powers they are going to have to act and coordinate all the different parties involved. And that's not to criticize the range of initiatives which have grown up. They've grown up through a series of entirely appropriate and well-intentioned responses to particular challenges. But a call from this workshop now to rationalize and streamline and to find the undoubtedly quite strong political leadership that will be needed in order to try and bring together these different responses under a more coherent framework. But the importance of doing that before the next crisis comes, as it inevitably will. And finally, on investing in health, there was a discussion focused on the use of European financial instruments to invest in health and healthcare, of which there are a surprisingly large amount, as was highlighted in reference to some work by the European Observatory on Health Systems and Policies about mapping those different instruments. And the potential of those was described through a European project involving Austria, Slovenia, and Belgium, which were presented at the workshop, and I won't go through all of that, but I think it would be fair to say that on the one hand, the experience of that pilot illustrated huge potential, and that there is real scope for European Union instruments to support investment in health, and that there are many tools that already exist, but that on the other hand, even with the will to make best use of those tools, that it still remains a highly complicated landscape, and that more effort is needed in order to rationalize that, in order to help make member states make best use of the tools which are there and intended to be used for these purposes. Colleagues, I hope that short summary reflects your recollections of the discussions and illustrates the breadth and interest of the challenges which have been discussed over these two days of the conference. And I think we can now confidently expect that our ministerial panel will bring up answers to all of these different issues in the next few minutes. And in the expectation of that, may I now invite the different ministers to come to the stage, and we can progress to the ministerial panel. And so, as you can see, the panel will be moderated by Minister van den Broek, the Deputy Prime Minister and Minister for Public Affairs of Belgium, who will be joined by ministers from Rina Sikkut, from the Ministry of Health from Estonia, Denis Kordej, the State Secretary from the Ministry of Health in Slovenia, Peer Dijkstra, Minister for Medical Care in the Netherlands, Dr. Thomas Steffen, State Secretary of the Federal Ministry of Health in Germany, and Jakub Dorofasek, Deputy Minister of Health of Czechia. Please join me in welcoming the ministers to the platform.
Yes, thank you, Nick, for your, I think, absolutely useful wrapping up of the workshops. I would like to start this panel with a question just to have a bit of an overview of priorities. However, my question is not the traditional, rather boring question, what is your top priority, or what is your main challenge? Because then we get the list we know. My question is slightly different, dear colleagues. My question is, what is the challenge that keeps you awake? The challenge you think you might not manage. So let's be honest about this. We won't tell any other people, so it's among us. But what's the kind of priority that keeps you awake at night? So let's listen to that first and then see what we can do at EU level. But first this question. So maybe I should start with Rina, if you want.
Happily. We're in the middle of implementing a tax on sweetened beverages and discussing how to sustain the financial sustainability of health system, because we face a deficit next year. And the Ministry of Economy has proposed self-regulation for alcohol advertising instead of current restrictions. So there are hot topics discussed in media and on government level, but I don't lose sleep because of that. Why I lose sleep is I strongly believe that the role of a minister is to explain. The issues in health policy as well are very difficult, and it's expected that whether it's my colleague, the Minister of Justice, or my voter, they cannot understand all the workings in the health policy. So to need to explain. What keeps me awake is finding the right arguments to counter the industry arguments, if we discuss, for example, the advertising, or a hot topic in Estonia, if we have a deficit in the health insurance system, maybe we should include more private money. But our out-of-pocket payment level is 22%. More than a fifth is covered out of pocket. What is more private than out-of-pocket spending? There is no room to increase any private contribution. And so, but the issues are not very straightforward, so I really need to make an effort to find good examples and arguments to credibly defend the position I believe in, and this is why I lose sleep.
Okay, so it's how to make the case and to win the case. Yeah. Pia, what is keeping you awake?
Thank you. Let me start by thanking you for the invitation to participate in this panel on the very relevant topic of EU cooperation. I just started as a minister recently, so it's a bit exciting for me to be here. But what keeps me awake, partly I understand what you're saying, but what keeps me awake at night are the questions on how to build and maintain a future-proof healthcare and affordable healthcare system. in particular the changing demographic situation and the ever-building labor shortages in healthcare are most pressing topics that are posing a huge challenge. We already heard what was discussed in the workshops, so it came back there as well. Our populations are increasingly getting older. And however, an aging society is accompanied by an increasing and more complex demand for care. This demographic shift means challenges to maintain our current level of healthcare and poses the question on how we can build a resilient and future-proof healthcare system for the next generations. And we really have to act, because if we do nothing, then the accessibility and the quality and the affordability of our system will be at risk. So integral action is needed. Well, there are more things that keep me awake when it's about healthcare, and also it is, of course, it's about how we can give the patients and the citizens of Europe what they need. That's part of what I just described, and that is one of the main topics that we have to work together in Europe on these topics.
Thank you. I hope, dear colleagues, that you don't mind that I did not present you, because the names are high on the screen. So I turn to Jacob. What would be your answer to that question?
I'm sleeping well, so, and thank you for the promotion. I'm not the Deputy Prime Minister, just a Deputy Minister, but it's okay. So it keeps me even better. You know?
There is no pleasure. There is no pleasure in being Deputy Prime Minister. So,
but yeah, I will build what was already mentioned by Pia. Yes, we are very successful. I see my colleagues from the industry, from patient organizations, from all in, and big thanks for that, Frank, because you create a very nice group of people or a very nice environment to meet together, which is not very common, and it's great. And if I can highlight it, one topic which I'm really, let's say, worry how it will develop and how we will manage it, is the success. The success story of the European system to support innovation, because we are really successful. If you see the number of innovation coming to healthcare, it's tremendous. The only question is, how we will manage it, and how we will really ensure that everybody in Europe will get this access, to the innovation which comes. And we have a beautiful tool on the table. We just have to somehow, imagine that every word, every month, every movement, in what we are now discussing, will materialize, in impact to our systems. We have to ensure, that at the beginning of the life cycle of pharmaceuticals, that we will understand what will be the real impact to our systems, and how we will at the end manage, that everybody who is, let's say, indicated will get to that treatment. So that's something, what I'm a bit worried. If we can really imagine what is behind each and every sentence of pharmaceutical package, because it's really essential. And I feel we need to talk more, not just between us, but also, with the stakeholders sitting in this room. And one more topic, I really appreciate, what you do with the word solidarity, because it's transferring, to some reality, which is really important. And what I still miss, is the discussion, how we will maybe, negotiate together, how we will move this, those tools we have it for the critical measures, in healthcare, how we will move those tools also to create, better access of patients. So yes, we have a great opportunity, but also the big responsibility.
Thank you. Thomas, you have the floor.
Yes, thank you very much. And like Jakob, normally I sleep quite well, especially after one glass of red wine. But what really keeps me awake at night is that in the corona crisis, I guess we all thought this is the biggest crisis in our lifetime, and hopefully it will not come back to us over the next years and decades. And then we found out that we are living in multiple crisis times, and health is always on the agenda. And that is why we need the better European coordination that you are promoting, Minister. Looking at that European coordination, I'm afraid that there are 4 points we should also discuss in future times. The first one I very much hate. This is the question whether we should prepare our health systems for a future military conflict. We have accepted more than 1,000 patients from Ukraine. And I can tell you that the medical doctors in Germany, they are on a learning curve because we have never seen those wounds, cuts and traumas. And I'm afraid that maybe we have to collect the experiences, especially in our East European countries, because I know how much Poland and other countries are also involved in that scenario, and to reflect on how we can best prepare for the future. So it is very much in line, Frank, with your headline: care, prepare, and protect. The second point is that I'm afraid we are living in increasing geopolitical risks and terrorist risks. So I'm afraid of a toxin, chemical or radionuclear threat. I'm not so sure whether all our health systems are best prepared for that, and we should also reflect on whether we can help each other if something happens in one of our member states. A third point, I'm afraid, is about climate change and how we all find best approaches to protect our vulnerable groups in our societies and our population. And I guess there is not one national concept for that, but we need the benchmarking in the European Union to best protect. Again, it's very much in line with your headline, the protect principle. And the fourth is, like you just said, in the Netherlands, I'm afraid about the aging population. We are an aging continent compared to Asia and other continents, and how to make the financing of our health system sustainable in a medium to long term. This is a real challenge where I would see some room for improvement in the sense of European coordination and cooperation.
Thank you. Dennis.
Yes, thank you. Well, everything that has been already said is very important indeed, but and what I'm about to say, it's not a political speech or a political parole, but it's a fact. I do not sleep that well because in Slovenia we are currently in our inglorious record of longest ever strike of the doctors. So what keeps me at night is how to ensure good working conditions and adequate pay and to incentivize our healthcare workforce to retain in the public health system. Because after COVID, we have a problem. And that maybe we had a problem before, but that increased now after the COVID. So this is one of really my main problems that are keeping me awake. So we nevertheless did over past years some incentives to keep our health workforce satisfied, at least as much as we can. But also our demographic trends are like we heard from Thomas and this past 2 days. We are prioritizing the recognition of professional qualifications from abroad, aiming to simplify procedures through a new act of the recognition of professional qualifications acquired abroad. We also addressed our shortage of doctors specializing in family medicine by introducing financial incentives, offering a 20% hourly rate increase and even higher supplement of €1,000 per month for choosing specialization from family medicine. And also we are introducing scholarships for choosing family medicine's specialization. We are constantly negotiating with the healthcare trade unions about working conditions and how we have to communicate with trade unions and together to come to an agreement to what is possible, because hopes or expectations are pretty high. Okay, I think that's a reflection of a COVID crisis, but still. To conclude and not to go too far, because our strike is ongoing and I don't want to intervene with that. Our healthcare workers during COVID were or have also adapted perfectly to performing other, not exactly their basic tasks. So we must now resolve the current situation and be prepared for possible new emergencies, that they are not necessarily diseases, or like Thomas just very good said. But still we have to ensure a resilient healthcare system. So that is why we have to find solution together at the EU level. So that's it. Thank you.
Thank you. That is exactly the point where we should be, because I would like in a next round to focus on the EU level, and then the question is, what is the leverage the EU can bring to bear? So let's focus on the EU level. I would suggest that in the next round I start with Jakob and then go to Thomas and then Dennis, so I let the men come first and then move to Pia and Rina. But I should say that in the first round, in my understanding, there was an interesting complementarity in what keeps us awake. I think Rina was about how do I convince my colleagues to invest? So we need resources, we need money, and how do I make that case? This is about investment. Then Pia said, yeah, but you need to find the people. How do we find the people? Then Jakob said, yeah, but it's also about innovation. And it's also about solidarity. And indeed, I think, Thomas, what you said about preparedness, it's not just to be prepared for the unexpected. The unexpected might be pretty awful. So this was a very sobering intervention, but I think useful. And I think we have to keep that in mind, even if it's not maybe a very mobilizing message, but the unexpected might be awful. And then indeed, Dennis, what you said about retention of people and having the right people in the right place. That's, I think, an important qualification. But then, given that complementarity of issues, which we all face, the question is really, what should the EU do? And if I say do, it's where are the levers? What should the EU do? What's there the main priority? Jakob, what do you think about that? I'll give you, say, 4 minutes, 5 minutes, something, if you want.
5 minutes, wow. Yeah. It's probably more than
you
enough.
You need not have them all. That's why.
No, absolutely not. I think it's about the coordination. And we can see it, I mean, in all the steps which we took during the last year when we fight with number of interruption of supplies of pharmaceuticals. Yes, of course, at the end, it's our responsibility in member states. But what have to be done on the European level is that we are doing the steps in coordinated ways, that we are not damaging by our national steps, the other countries, and that we are making the environment more safe. And if I take the example of stockpiling, it's now like a wave coming through Europe. Yeah, everybody is now changing legislation. We are creating, let's say, more and more requirements to keep the supplies on the level of distributor, on the level of state, etc., etc. But we are living in the space which have a limited resources. So at the moment, when we start to panic, we will create even more pressure, on the access and on the availability around Europe. So I'm really happy, that we are moving, with the Critical Medicine Alliance, that we are moving with the solidarity system, because we really have to understand what's happening around us. Especially small, mid-sized states, we are really, dependent on what's happening in the big states. And yes, every small step can create the problem, for the patients around Europe. It's a very fragile system now. We can see it, how, let's say, the small issue can really create, the unavailability, which is channeling state by state, very quickly through the whole Europe. And that's the role I see here on the Commission, but also on each and every presidenting country, because it's something, what we have to really, we really have to coordinate it in a very good way. We have to understand, what we are setting up in states, the goal to find the golden standard, to find a way, how to share between each other, to really move it on the level which is sustainable, and then to really understand the needs of our industries. We are dependent on them. And I still have like 30, 40 seconds. Yes, you said 5 minutes, so it's still less. We also have to work closely on the European level in the legislative development. I can name it in a few legislative outputs, directives, which come recently to systems, which are not health, which are not directly connected to health, but they will have a big impact on healthcare. One is, for example, the Critical Infrastructure Directive. We are now implementing in member states, this directive. If you take the healthcare, it's a small part of the directive, but it says who is a critical infrastructure: distributors, producers, R&D facilities, testing centers, etc., etc., etc. And there is so many requirements which those subjects will have to do it. And the question mark is, if they have resources, if they could really manage it, and what will be the impact on the production, on the flow of pharmaceuticals, or any medical devices, because also medical devices is the part. So we have to be cautious on all of those legislative outputs which comes from European Commission. They coming from us because we are the part of that process. But sometimes it's not the ministries of health who are, let's say, the one leading this process, and we are sometimes missing, the impact what could be on the healthcare. The second one I can name it is the Wastewater Treatment Directive. Again, quite a significant impact especially on the generic industry. So yes, this is something what we have to manage somehow with a lot of attention to ensure that we are not over-regulating the system and we are not damaging the system by unnecessary steps. I'm not saying it's not necessary directives. They are important. We just have to understand what will be the impact, if we are ready to really manage this impact, and if we have resources to somehow sustain those requirements.
Thank you. If I may summarize, basically what you say is there is urgency in getting our act together. Within the health domain proper, in terms of coordination, but the example you have given about critical infrastructure is interesting, because a week ago I kind of signed a proposal for what we call a royal decree on this with regard to the impact on the hospital sector, and it is indeed sensitive. It's absolutely, it's sensitive in the field and politically, yes, absolutely. So basically we should get our act together at EU level. That I think is absolutely correct. Thomas, how do you look at the EU arena?
You should first know that Jakob and myself, we always agree. That is why I can simply echo what he said. In my words, let me maybe start again with your very valuable principle of Europe that cares, prepares and protects. I think this is what I also understood from Jakob. We have to define from time to time who is Europe. And in my understanding, Europe means, of course, the European institutions, but of course the member states, because most of the health competences lie with the member states. And the last thing that we could need now in the European Union is a discussion about competences. We need a discussion about the best concepts and the best solutions, but not about the competences. And that is why we have to work closely together. And Jakob is also right. It goes beyond the European institutions. It goes beyond the European member states. It also involves the industry, because we are discussing in many ways market mechanisms and how we make them most effective and efficient in favor of our people and the patients in Europe. And that is why things are so complex, and that is why we need a cross-sectoral approach. What we discussed yesterday is not just about health and santé, it's about industrial structures and strategies. It's about trade, it's about third countries, it's about geopolitical strategies of the European Union, and we have to put it together. And that is why you are right. That under your presidency, and I very much hope, of course, this will be continued in future times, we have to bring together the main stakeholders on a policy level to get the policies right, especially when it comes to the pharmaceutical package. I understand that at the end of the day, and very much looking forward to discussion in the next EPSCO under your leadership, that we will have conclusions about the Critical Medicines Alliance. I very much hope, again, under your leadership, we can also make some progress on the legal side, the Critical Medicines Act, because alliance is a nice thing to have. At the end of the day, we also need some legal progress to be made. And last but not least, I very much hope that we can also, to some extent, anticipate what will be in the broader pharma package at the horizon. And this, again, makes the things a little bit more complex, but I'm very confident that we will have some good results in the next EPSCO. And maybe just to mention one more point, because I believe it was in your very, very good summary, that we should not forget about the latest achievement under the Belgian presidency, and it is the European Health Data Space. And at the end of the day, I agree, it's all about data. And we don't use our European data the way we should use it, or like the United States use it, or China uses it. And China is simply not the benchmark, you know. We have to strike a balance between data protection rules in the European Union and the use of data for the patients, for better diagnosis and better therapies in future times. And this is now in the European Health Data Space. And my proposal will be also to the future presidencies. It's not just about having a legal frame now in place, it's also about implementation in our member states. We should really evaluate whether it's working in future times, and if it's not working in future times because each and every member state has a different interpretation, then let's sit together again and try maybe to turn things into a better direction, because at the end of the day, what counts is that it makes a difference in reality for the patients in Europe.
Yes, yeah, interesting how you bring together the kind of challenges we discuss and I would say the current and future legislative agenda. And I would even go further than what you say on the European Health Data Space. It's a matter of culture in the field about how we register data, how careful we are about data, what the quality of the data is. And that's an uphill battle everywhere, but we should now have it at the EU level. I fully agree. Dennis.
Yes, thank you. Well, firstly, I want to say that your key policies that are the priorities of the Belgian presidency, EU that cares, prepares and protects, needs to be addressed by the future Commission. This is a must-do. All the topics that we have discussed over 2 days and right now are crucial to strengthen our health system. That's a fact. It's essential that the future Commission and the future EU Council presidencies build on the work that has been undertaken so far. But I cannot go beyond what I already said, and the field of healthcare workforce should be and stay a priority by the EU in the forthcoming years, because without satisfied workforse, we don't have a system. So that's a must. So as we, or many member states face a lack of healthcare workforce, and it's keeping or making our waiting lists longer, we need to a comprehensive EU health workforce strategy to assure equity in accessing healthcare services, including preventive measures to achieve good health outcome of EU citizens. We need a common framework of some crucial elements like planning, education, training, data collection, digitalization regarding health workforce, etc. We should consider updating the way we recognize professional qualifications and standardize competencies across member states, as well as consider a toolbox for transferring good practices between member states so that we can help each other. It is important that the Commission provides further support to initiatives focusing on health workforce retention policies, access to health care in underserved areas, and the reorganization of care delivery between hospitals and other community and primary health care centers through devolution and interpersonal coordination. In general, we need to promote workforce retention and recruitment in the health sector. We all need to focus on concrete activities, measures and policies that can be implemented in practice, because we are talking a lot about health workforce, but we talk. We don't do any concrete frameworks that can be then promoted or used across member states. It's important to continue and more concretely and identify where the EU can contribute, as there may be other options that have not been addressed. And the Commission should include those issues in its short-term working program and also in the cooperation with some international organizations like WHO and OECD. So I think that this is the main focus that I think it's important that we say to the forthcoming years. So if you allow me just to go further and to go and say that Slovenia supports further development of a common One Health approach, as has been adopted with the EU Action Plan on AMR and Europe's Beating Cancer Plan based on health in all policies approach. Both raised awareness and strengthened the action within the member states and the EU, and a common framework would be welcome also for non-communicable diseases. I would just, for the end, once again like to call to mind the Council conclusions adopted during the Slovenian presidency, which are connected to the EU Health Hub discussed in the morning. Our common and new Commission's ambition should be better use of existing, but also develop new financial and technical assistance mechanism available to member states in reforming or strengthening health system to cope with the existing and future health or other challenges or crises to come.
Thank you. I think it's good that you mentioned the WHO and OECD's work on healthcare workforce and broader. I think we had a very useful ministerial meeting at OECD level with very good input, I would say, on tackling the health workforce challenge. And obviously WHO is well known for its input there. Maybe Nick, can you just pop in on the session we had on healthcare workforce? For you, was it clear if I ask 1, 2, 3, what should the EU do?
Honestly, I think there was a lot of issues, but I think it was exactly a topic of discussion as to what should the EU do, because there are so many different dimensions that were raised, I think, Minister. So we had these different areas of data, of understanding what the challenges are, of things like the working conditions, and working conditions sounds very national, but it relates to things like the qualifications and the training. And also one issue that maybe I didn't highlight in the discussion is the impact of migration between different countries. And I don't know if it's a coincidence that the pressure is felt particularly strongly in Slovenia, but we know that there is a pattern of migration throughout the European Union which has a particular impact on countries which are lower in resources and towards the south and towards the east, and flows of countries elsewhere. So I think there was a clear set of issues, a broad, complex set of issues, but maybe not consensus on, there was a need for action, but maybe not a clear kind of, this is what needs to happen now.
Yeah, it's also my feeling. I guess that what comes out is that we need somewhat more debate among us to really get agreement on what the EU should have on its agenda here. So, but that's interesting. Pia, I would like to return to you for your take on the EU's agenda.
Yes, well, at first I want to say that all the developments which we have mentioned, which are mentioned here, demand a resilient Europe. And I fully support the priority pillars that you, as the Belgian presidency, have put until now. When it comes to increasing our resilience, it's important to mitigate our strategic dependencies and vulnerabilities in the supply chains of medical products. Shortages of critical medicines are a serious and urgent concern, which forms a threat to our union as well. And we need to work together as member states and show solidarity. The word has been mentioned before, and that's of course an important issue. Therefore, the Netherlands welcomes and supports concrete European initiatives to increase the availability of medicinal products and prevent shortages. I believe it is important for all relevant stakeholders to take responsibility in solving and preventing shortages. And the Critical Medicines Alliance can provide a good forum to discuss the current issues and solutions with all stakeholders. And this can only work, though, if all stakeholders show equal commitment. When we talk about the vulnerabilities, the analysis by HERA on the vulnerabilities in production and supply chains of selected critical active substances provide a very good basis for this discussion. The tools for a European approach, which is of course what you asked, need to be further developed, for example, by assessing whether existing economic instruments are sufficiently suitable for stimulating and strengthening pharmaceutical production in the EU, the added value of the Critical Medicines Act and the role of international partnerships. With regards to preparedness and health security, we built the foundations to be better prepared for cross-border health threats by adopting the EU Health Union legal package and the establishment of HERA. And when asked the question whether we are better prepared for a health crisis now compared to 5 years ago, I would say yes, but not enough. However, we are not completely ready. We cannot shift our focus to other priorities. It's important to challenge our crisis structures by exercising, which is mentioned also in the report of the workshop. The way our crisis instruments are connected and complement each other should be clear. Activities such as those carried out by HERA necessitate structural financial support and a strong position within the Union. And last but especially not, absolutely not least, there's one topic which cannot be neglected and which is already mentioned, is the climate change. The effects are becoming more and more visible. I don't have to tell you here what the effects are. Working together on approaches to the health risks of extreme weather events and increased risk of infectious diseases posed by climate change will make our societies more resilient. However, efforts on climate adaptation will not be enough. The impact of the health sector on climate change should be taken into account as well. And we should recognize the interaction, so the other way around is also important. For this reason, I believe we should work together on a common EU agenda on climate change and health, taking into account both climate adaptation and climate mitigation. Well, I leave it to that. There's much more to say,
No,
but
but there is kind of if I may, a bit of a, I would say, constructive, critical undertone that we might still insufficiently address the link between climate change and our health agenda.
Yes, you're
yes.
right.
Okay, thank you. Rina, what do you think we should have on the EU agenda?
First, I echo my colleagues. I think the Critical Medicines Alliance is an important step, aiming for strategic autonomy for pharmaceuticals. Also, as Thomas said, now that we have agreed on the European health data space, let's implement it. Make it actually give us back. So these are very important, I don't know, things that are already moving forward. But when looking into the future, health policy is not separate, or health union is not separate from the European Union. It's a union of values, and it stands out by taking this human-centered approach and valuing the single market. We are stronger together. The single market is something that is valuable and should be protected. So I would bring two examples. One is pharmaceuticals. As Madam Commissioner says, we don't have first and second class patients. So making the single market work for our patients as well, I think it is very important to carry this pharmaceutical package or regulation forward to actually achieve this outcome. But secondly, this is a more specific proposal tied to the human-centered approach, because when we discuss AI in the world, Europe is the one that's, but we need to make sure that human stays in control. When we discuss the state of data-rich world and the behaviors here, we say that no, privacy is important, data protection is important, and we have to regulate it similarly in EU. But the same, for example, in tobacco policy. I think when we collectively aim for a tobacco-free generation, it is ambitious, we stand out, and it's something we can only do together. And at the same time, giving the responsibility to member states, it's very difficult to say that I don't prioritize economic growth or the freedom of people to choose. But the arguments that the Netherlands is regulating it differently, or someone else, it's so difficult to make the case nationally. But together the public health will benefit, and it's something that shows that Europe is stronger together. And it involves the cross-border trade element as well. When we discuss single market, Estonia has restricted distance selling of tobacco products. Very difficult to implement. But we could do it together. So ambitious goal, tackling the industry arguments as a union, not as separate member states, and we can make a change for future health. And these are the issues we should look for. And as we celebrate the 10-year anniversary of Tobacco Products Directive, we see that the market has changed a lot. The need to adjust, to modernize the directive, to actually achieve the aims we wanted to achieve when we adopted the directive, and with health workers to make it more interesting. I don't think it should be European legislation or a priority. What we should do, sharing best practices, how to motivate young workers to or choose medicine or train in medicine. But as we have a single market restricting the movement of healthcare workers, or as in Estonia I often get the question, since education is free, that if the taxpayers pays for the doctor's education, why can't we make them stay in Estonia? Well, it is a different world when in one specialty, in medical school, we order you to stay and work in Estonia, and in all other areas, you are free to choose. It makes the health curriculums less attractive, and I don't think we want to be in this situation. So the single market is valuable, even if it's difficult in some cases. For Estonia, when health workers have migrated to other member states, but I think there are cleverer ways to tackle the issue. It's not the EU regulation that we need in the coming years. Thank you.
Okay, thank you, Rina. We have 4 minutes left before I hand over to Nick and the audience, and I really would like to do that. So basically that means that each of you has the possibility to intervene, either to give a very short reaction on someone else, or a kind of take-home message if you reflect on this conference. What would you say to people back home about this conference? What's the take-home message? Anyone volunteer? Thomas?
Yeah, very briefly. There's one medal I would like to take home, and 2 sides of that same medal. The first one is the perspective within the European Union, and what the Commissioner said, that we are stronger together, and this has a lot to do with governance and with priorities to be set, and we should do that together. To be stronger in future times, especially in health policies. And the second side of the medal is the external perspective. This is also what the Commissioner mentioned. We have to reach out to third countries, also on health policies. And again, we should do that together in a more coordinated way compared to what we did in the past. And health workforce is a perfect example for that. I guess we are doing that on a national basis, reaching out to South American countries, Asian countries, to see how we can steer migration into the health sector. Maybe there would be some better coordinated approach. And I give you a funny example where I thought we should really have that European approach. I had a meeting with the health minister of Uzbekistan last year. And I said, we are really in need of getting more nurses and health workers to Germany because we need that in the healthcare and for the elderly people. And then he looked at me and said, if you wish, I can send you 1 million nurses tomorrow. And then I thought, maybe I should reach out to my European colleagues and friends and ask them whether we can share the 1 million nurses from Uzbekistan.
Okay, that's we could start a long debate on that one. Anyone else? There's no obligation. Someone who wants to final comment? Not really. Then Nick, it's exactly in time for you.
I'm not sure I'm in favour of these ministers moderating things better than moderators, you know, Minister. So what Minister van den Broek means is not over to me, but over to you. So this is the opportunity to ask questions, and I can see some hands already. If I can take the lady in the middle there, and then the lady on that far corner. Ministers, is it okay if we take a few? Yeah, and then give you the opportunity to...
It would be useful if people indicate who they would like to give an answer in the panel.
Otherwise
we can volunteer.
So if you would like to, I think it will help if you direct your question a bit, and would you also give your perspective, introduce yourselves and say who you are as you speak, basically.
Yes, absolutely. Thank you so much. Thank you so much. I was really thrilled to be able to attend this ministerial panel discussion, and I'd like to steer the topic again to the health worker migration and mobility. Thank you, Nick, for also bringing that up from the health workforce session that we had yesterday. Because it is, if there's something that the EU could do, it's on that one. And I'm not talking about the 1 million nurses from Uzbekistan, because I think that's a completely different discussion altogether indeed. But the fact is that there are indeed quite some negative consequences of excessive health worker migration and mobility. And I was also wondering why this panel is composed like this, with a couple of sort of traditional sending countries and traditional receiving countries. I haven't said who I am, have I? No, sorry. My name is Corinne Hinlopen. I work for WEMOS, which is an NGO based in Amsterdam. Our tagline is Make Health Justice Happen. So my portfolio is health workforce, health worker migration and mobility. And my recommendation or suggestion would be that if we start monitoring health worker migration and mobility on the basis of a simple indicator in the European semester process, and the indicator is what is your reliance on foreign-born and foreign-trained health workers in your health workforce. And it's not to judge or accuse, but it's to have the debate. Minister van der Broeke mentioned it. More debate is needed among member states. Have the debate. Why are so many health workers going from one country to the other? What can all the countries do to actually mitigate these negative consequences? And have that debate and put it in the cycle, in the European semester cycle, to have the debate regularly and then tackle it. Thank you so much.
You heard my point about being a data nerd, and you proposed an indicator. I love it. There was a question over there, and then I'll come to the gentleman on the end there, please. Yes.
Thank you for the panel. My name is Lilia Olivier. I'm director of the Smoke-Free Partnership. I arrived to Brussels in April 2022. I've been working in Ukraine for, well, I was born and raised there. I was working there on tobacco control. Thank you for mentioning Ukraine. Thank you for supporting Ukraine. The EU came together immediately, and just on behalf of Ukrainian people, Ukrainian government, I want to say thank you. One of the lessons learned for us is that no matter how much we want to deny the worst is happening, and we have to prioritize, and that's what you are talking about. And what you've mentioned about starting to learn now about how Ukraine is dealing with all of the casualties, and that's the actual war that is happening that didn't happen for the last century or so, and how we do prepare now. But at the same time, when it comes to prioritization, we cannot allow to waste our resources and time discussing the issues that we should compromise on, such as tobacco and alcohol control. This has to be solved because there are other more important priorities. And I speak of experience of Ukraine, the country that is at war and looks for various resources to have the budget revenues, including annual increases on tobacco taxes, 20% annually. So my question is, what are the next steps in the next 2-3 years? Well, actually, next half a year, to prepare for the worst and put aside the discussions that and table the easy hanging fruits such as tobacco and alcohol. Thank you.
Thank you. That's quite a striking question. This gentleman down here. Thank you.
Yes, my name is Veli Mikniemi from the Finnish Ministry of Social Affairs and Health. And since we are about 10 weeks ahead of European elections, I would like to ask you, as politicians, I'm only an administrator, what would be your message to European voters on the work we have been successfully discussing for 2 days? And in particular, in two views, we are facing a strong need for more work on security and preparedness. What is the European Union doing in the health sector for the preparedness, and how will it affect EU citizens? And the second will be how we can provide and prove that the investments we have been discussing a lot are beneficial for all, not only for health sector, but also for the whole of society. What are our tools to do that? These two questions. Thank you.
Thank you. I know there are many more who want to ask questions, but these are already so useful that maybe we, Minister, what do you think? We start with these three?
So maybe I can react on the last one, on the preparation for for the worst. And I already mentioned it here, the critical infrastructure directive. And we have to test, we have to find, how capable are our, let's say, healthcare providers, distribution chains, all the infrastructure we have in healthcare. That's what we are now, what is our high agenda now. We have to modulate it, we have to find out what capacity will be required for certain moments and situations which may maybe not come. But all the directive is about this topic, and we will have to invest a lot of resources to really understand, how robust our systems are, what are the extra capacities we can create it if there will be a need. Doesn't matter if it is war or any other catastrophe. Our systems are, I believe, in Europe very robust compared to the rest of the world. But of course, we have to understand, how to manage those resources at the right time and how to create the capacity which is maybe not normally used. But that's under the review, and we are preparing for that. We are changing our national legislation. We start a discussion with those subjects who could be considered as a critical infrastructure, and it's the response.
And then maybe on the, I was thinking, yes, indeed. Do you want to go ahead?
Yeah, maybe very briefly on the election coming up, as Jakob said. At the end of the day, I think what we sometimes tend to do is to sit together and to discuss the deepest substance possible, and to really dive into the problems, the options, and possible solutions. And we really, let's say, are in internal discussions kept and captured. What we at the same time should more focus on is communication, and really convincing the people in the street that Europe, also in the health sector and with health policies, is stronger together, and that the people in the street will benefit from that European cooperation and coordination. So that means not only in times of election, communication sometimes is 50% of what we should do, but we don't deliver 50%, again, because of the complexity of some of the problems. But especially before an election, we should communicate the benefit and the added value of European cooperation. Otherwise, maybe this European Union will be a different European Union after the election, and we cannot wish for that scenario. Second point on Ukraine, I would like to echo everything what you said, and again, it should be on our priority list very, very clearly. On workforce, and I like the European semester very much, we should really see what we can do on more transparency. I always have the impression that the freedom of movement is something where there's still room for improvement in future times. And I simply don't know why health workers go to one country but not to another country, and I'm very sure we cannot overcome that overnight. But more transparency, why this is the case, maybe also discuss an indicator, maybe is a good thing forward. And the last point on tobacco and tobacco control, I personally would be very much in favor of steering tobacco consumption more through taxes. But then you need consensus when you are a part of a coalition government, and that is why sometimes it's not the right time and not the right place to go for higher taxes. But if other countries do that, and they have maybe good results with that option, please communicate these results, that maybe consumption and also diseases, non-communicable diseases like cancer, will go down and are going down. And then we have another benchmark, and we can feed into our national discussion that kind of benchmark.
And this is what happened with smoking in public places, right? Was a good example which was well shared and created a dynamic. Minister, did you want to comment?
Yes, first we have to declare the conflict of interest, and I have to admit my sister works as a doctor in Germany. But I support the proposal to include an indicator in the European semester process. I think this is exactly what we need. more transparency, certain monitoring system, a common methodology for forecasting models. This is what we should do. About crisis preparedness, although there are certain things we have done in Europe, whether it's investments or regulation of critical infrastructure, but we are always preparing for the past crisis. But I really believe that a well-resourced health system is better prepared for any crisis. So when we have enough healthcare workers, new facilities, information systems, data can move across borders, we have coordination mechanisms, we can jointly procure, whether it's vaccines or something else. If everything this works smoothly in a non-crisis time, we are better prepared for crisis. So we have to work on better, cooperation mechanisms and public health aims that are there already, understanding that at the same time we are better prepared for any crisis.
Maybe a few reactions. First of all, thank you very much for the intervention by someone who first recalled what is happening in Ukraine and what that means to everybody of us. I think that was important. But then maybe following up on what you added, the agenda on tobacco and alcohol. Personally, I think at the EU level that is relatively simple. It's just doing what has been promised in the context of the European Beating Cancer Plan. And what has been promised makes absolute sense. Let me give one example. When it comes to taxation, Thomas, we are in a typical prisoner's dilemma. You need coordination or you have suboptimal strategy. My government, but I was very much pushing for that, my government increased the price of tobacco products by, say, 60%, by adding taxes. On the 1st of January, from those 60, there was 25% increase in one movement. And so we pushed our prices just to where we think it becomes completely counterproductive because people buy, obviously, a lot of tobacco products in France, and we have that difficulty. And so the discussion I had really for hours was on the cross-border impact. And so I was able to push it just at that level where I could convince my colleagues that the cross-border impact would not be too detrimental. But to the credit of my colleagues, I think they honestly say that if France would further increase taxes, or Germany would do that, then they would go further. And they mean it. So it's a typical prisoner's dilemma. And so the EU initiative on cross-border taxation is absolutely essential. There must be a framework on this. The other example, obviously, is labeling, which we discussed. Labeling is a typical internal market issue in a sense. You need a European solution to that. And so I think the agenda set out when the EU's Beating Cancer Plan was developed is an agenda which we should take up, including also the update of the directive on smoke-free environments. And I understand that the directive on smoke-free environments is touchy, because obviously we enter into e-cigarettes and vaping, but we should take that on board. We should take it on board. But so for me, the answer in a sense is simple in terms of agenda, more difficult politically, but I think we should fight for it. And then maybe just one comment on the voter. For me, we have opportunities in terms of what we tell to voters. I'm very much addressed by people on shortage of medicines. Because when you go to a pharmacist and you don't find the drug you need, it's upsetting for the patient, it's upsetting for the pharmacist, it's upsetting for the doctor who wrote a prescription. And so there's a lot of talking about this. And if you can say to people, it's not an excuse, but I really need EU action here. We need EU action, we need the EU, we need the Commission, we need Parliament, and they need a view on this. I think you can convince people about the necessity to cooperate and the necessity of Europe as an arena for policy making. For me, that's a prime example. It's a very practical example which you can use in an election campaign about the EU.
Unless there are any immediate interventions, then maybe we take the next few questions from the floor. So, yes, please.
Thanks a lot. My name is Caroline Kostongs. I'm the director of EuroHealthNet, which is a partnership of national public health institutes. I would very much like to welcome your suggestion of Pia Dijkstra of working towards an EU common agenda or strategy on climate change and health. Very nice. But what keeps me awake at night are the high levels of childhood obesity. There are children with high blood pressure, even type 2 diabetes. It's linked to a high cost of living crisis. It's all very unfair due to social injustice and also the increasing health inequalities. And these are topics I haven't yet heard about, and I would like to see what you're thinking of this and how we should include it better in the European Health Union for the future.
Thank you, Caroline. And then just immediately behind you.
Good morning. My name is Jean Weinbach. I'm head of the French delegation and deputy director for European International Affairs of the Social Ministries in France. Coming back to the political continuum that we need to foster and strengthen the European Health Union, I think indeed we should better communicate to our citizens, but there is another interesting way. This is also to use the interest that other regions of the world are giving to the European Health Union and what we are achieving together and the next steps. And to that end, we have a very important time point on the agenda. This is the next World Health Assembly. We are all committed to quite tough negotiation for the agreement, pandemic agreement, and the amendment of the International Health Regulation. And I would like to know what we, as the European Health Union, will present, being proud of our achievements together during this assembly, and how we will also talk to the external parties and stakeholders that are very interested by the European Union, not only the accession countries, but also Africa, Latin America, and Eastern Asia, for instance, because I think this mirroring effect is very positive to mobilize the political attention in Europe. Thank you very much.
Thank you. Quite a specific question, so we'll see who feels like a volunteer on taking that one. As Minister Van den Broek said, if you wish to direct your question to a particular minister, I'm sure they would appreciate it. And the gentleman just there, please.
Thank you very much. My name is Philip Haagdorens. I'm a nurse researcher at the University of Antwerp, so here in Belgium. Very nice conference. I'm very happy that we're talking about nurses and doctors, health workforce crises. One of the reasons that nurses are leaving the workforce at the moment is, and this is from my own experience, but also from research from the last couple of 10 years, is because of the lack of autonomy they experience in practice. And to have autonomy as a nurse, that means that you also have influence in policy at your practice level in your organization, but maybe also at a higher level. And we've seen, I think it was last year, a new legislation on nursing, a nurse's voice in the Netherlands. And just my question is, should we have this on an EU agenda? Because this is one of the main reasons nurses are leaving the profession. Thank you.
Thank you. So 3 quite distinct questions, and then seeing how quickly. So, Minister Stefan.
Okay. No, thank you very much. First, I believe, what was already said here, that we should have the good European plan for each and every diagnostic area. We start with the oncology, but we should move to rare, we should move to obesity, we should move to diabetes. It helps us a lot, and Yeah, of course, I mean, we have to do the final steps on our states, yeah, in our national environment, but it's helping us a lot. If I have a standard which is set, by, for example, the European Beating Cancer Plan, then it's much easier for me to push that standard, to our system. And yes, there are a lot of other, disease areas which will require such a support. And I mention it, and it doesn't matter if it is the obesity, diabetes, or the rare. We should move, with that, because it's helping us to implement those requirements in our national countries. And to react, on gentlemen asking about the autonomy of nurses, yes, that's exactly, what we have to do it. I believe, that we have, maybe at least, in Czech Republic, we have enough medical professionals. They're also moving to Thomas, to Germany. They're moving to UK. We are receiving the support, I would say, from Slovak and from other countries. It's some kind of cycle, yeah. But at the end, I believe we have enough. The only thing is the allocation, and if those people are really doing the job they study it for. If they are really doing, what is the expertise, they are not doing the administration steps which could be done by somebody else. And if we will be able to take out, this administration burden and better organization of the care, we will have enough medical professionals, in the Europe. I believe we have trained so many people. We are still continue to do that. So the capacity is here. But of course, again, it's very difficult to fight, on a national basis with the other interest group, I would say, who doesn't see the autonomy of nurses, for example, as the priority number one. So yes, again, if we can discuss it on the European basis, if we can have a recommendation, it will be much easier to do it in national states.
Yeah, a brief word on the nurses. I think the situation is a little bit complex. Indeed, we have many nurses, for example, caring for elderly people coming from Poland to Germany, but they work 24 hours in the household. And this is strictly against the German labor law. And that is why we have to discuss how to overcome that situation. So yes, Jakob is right, the capacities are there. In practice, something is working, but then someone will find out that legally this is not possible. And then we have the discussion again, and it would help to also have some European dimension in that discussion. First point. Second point, we are just preparing for more competences of nurses in Germany. Exactly for the reason that you said. More than willing at a later stage, maybe in some months, to give examples what we are developing and also to collect other good examples from other European countries. Third point, I guess it's also about part-time. We have a lot of nurses working part-time. If they worked full-time, we would have much less problems. So what are the incentives to work part-time? This is also something that maybe we should discuss on the European level. And on the pandemic agreement and what our French colleague just said, I agree that we should also have that European exchange again. I'm very grateful to the European Commission that they're doing a great job in Geneva to find solutions for that very, very challenging process in Geneva, which to some extent is derailed because we don't have so much common space between the global south and the global north. And we are approaching the World Health Assembly in May, so just some days to go. And again, it's not very likely that we will find a solution for May, so there are only two options. Either we go for a more principle-based approach, a lean text to be approved in May, or we extend the negotiations. And none of these options is a very perfect one. I very much hope that within the next days we really find a proper way forward. And we should also look at some geopolitical risks. I guess we cannot lose the United States in that negotiation because of their general elections coming up, and they have no appetite to make the pandemic agreement part of their general election campaign in the United States, because this was very much help one of the candidates and not the other candidate. So things again are quite complex. I hope for the next days to come.
I'll continue and support. Yeah, I think we should agree in May, but the question also involved that what can we bring up as benefits of a health union, and I think the Commissioner very well outlined 6 pillars and all the issues as something that are really, I think we stand out in the world, but with tackling them together. And the Europe Beating Cancer plan is something that others, I think, should, I don't know, learn from. But previously, I forgot to answer to my Finnish colleague that honestly, I think it has never been as easy to go to the European election as a, I don't know, Minister of Health or a health professional with, as Frank said, the availability of medicine and affordability of medicines and crisis preparedness. These are 2 issues that are well explained and easily understood, and people actually see the need and the benefits already. So these are the 2 issues that can be brought up in the election debates or discussions or conversations with voters as well. About childhood obesity, as I proposed going forward with the tobacco-free generation, I also think European, we have a child guarantee, but shaping the environment to support healthy life of children is something that is very difficult to I don't know, fight on a national level. There is strong agreement that yes, children's health is something we should all prioritize, whether it's labeling or curricula or programs in schools to make students or children move during the school day. It's all something. Some can be just best practice that we share, some can be financed or prioritized in the next MFF. But for example, in Estonia, for the first time, we see that there is a difference in children attending sporting activities or hobby activities based on their socioeconomic background. 10, 15 years ago, we didn't have this inequality. Now it's there. And I think we are not the only ones. So there are definitely ways to intervene on a national level, but also on a European level when we talk about labeling, food production, and even best practices that we can take over from other member states. So thank you.
Yeah, given the time, I'll do it staccato. So the point on obesity is well taken. Indeed, that's maybe insufficiently in the agenda. So I'll take that with me to discuss it with my advisors. There is good reason to, let's say, re-emphasize obesity, also given the kind of drugs we see coming on the market. And these drugs might be game changers, but they will not be game changers if we think they are the only solution. So there's good reason to have that on the agenda. On the pandemic treaty, I will be very brief. I hope that the Commission takes a position that is sufficiently flexible to make progress. I think we have to overcome a little bit ourselves if we want to land with the pandemic treaty or find a solution. Finally, maybe some more words on healthcare workforce, and I hope not to do injustice to the debate or to the people who have been committed to the debate and the workshop, or I hope not to sound unduly critical. But I was very pleased with that remark on autonomy, because sometimes my feeling is that at the debate at EU level on healthcare workforce is slightly conservative. That is, it repeats things that are absolutely correct. We need to invest more in salaries, working conditions, training. Absolutely correct. But we also need reform We need reform in the organization of the profession. And typically, the EU is an arena in which you can shift the frontier of your thinking. That typically happens at EU level. We should also do this when we discuss healthcare workforce. We should shift the frontier of our thinking on the workforce at EU level. It so happened that yesterday, I was not here because yesterday in the afternoon I had to pass a bill on the nursing profession in the Belgian parliament, and luckily in a first reading it passed. And the bill is about more autonomy for nurses. That's part of the bill. It's a completely new description of what nursing is about, which was absolutely necessary. It creates a possibility for more autonomy. I introduce in our legislation the legal notion of team, a structured team, within the team more flexibility, and the nurse being the coordinator of the team. And we have then a discussion, which is a very difficult discussion, with a lot of conservative resistance to be overcome, with a lot of references to what is happening elsewhere in Europe. And I even distributed a note. I had a note made with lots of references about the European discussion and international scientific literature, etc. As a matter of fact, I would like to have that debate more at EU level. We need that debate more at the EU level. It's about investing in the healthcare workforce, but it's not simply about multiplying what already exists. Multiplying what already exists is no recipe for the future. But then again, that's the reason why I think having a healthcare workforce strategy as part of the EU agenda can be very promising. But we should shift the frontier of our thinking.
Yeah. Minister, oh, sorry.
Sorry, just I had a little difficulty in understanding the questions because my ears are not working very well, so that's a problem in this situation. But I wanted to add to what you said is that it is also important. I fully agree with you about nurses and the workforce, but I would also stress that it is important to remain mindful of the way existing EU legislation affects labor shortages in healthcare as well. So that was only one remark just to end this. Thank you very much.
Thank you. I know that there are other people who want to ask questions, but I think for sake of time, we are probably out of time. But the fact that there are people who want to do that shows their interest. Minister van den Broek, this was, I think, a very successful conference. I might turn to you to just give us a few closing words from your perspective. And as you take the stage, ladies and gentlemen, join me in thanking the ministers for this panel.
Yes, thank you, Nick. Well, first and foremost, I would like to express my gratitude to each and every one of you for your devotion to advancing the discussion on the future European health agenda. I think over the past 36 hours, we've seen an impressive gathering of some 300 experts, activists, members of parliament, ministers, commissioners. And together we've delved into critical issues such as the health workforce, security of medicine supply, the prevention gap, crisis preparedness, and making strategic investments in health. And let me say that yesterday morning, Laura and Beatrice re-elaborated home, reminding us just how much these issues affect people across Europe. That's the heart of the matter, isn't it? Ensuring that Europeans can live healthy, fulfilling lives, and when they're not feeling well, we must ensure them that they have timely access to care and medicine they need and the quality care they need. We should not lose sight of that. Now, the ability of people to lead healthy lives begins with our courage to take the necessary steps to ensure healthy lifestyles for everyone, has been said in the panel also. Whether it is through alcohol labeling and taxation, like we discussed, or the innovative food apps that are so popular among youth, we must ensure that preventive actions set out in the European Beating Cancer Plan translate into tangible results. This isn't just crucial to the well-being of Europeans, it's also essential for the future financial sustainability of our healthcare systems. And indeed, we talked and we should talk about some tough realities. When Europeans do get sick, they need access to doctors, to nurses, to medicines. No one wants to hear they're waiting on a waiting list or that their treatment is out of stock. And so I think we know by now very well that these shortages, these bottlenecks are among the biggest worries of health ministers across Europe right now. We need that commitment of that workforce, and what they deliver basically is always this fantastic mix of science and solidarity. Healthcare is about science and solidarity. Now, Europe is crucial for that solidarity. I think that is the message. And so we need European solidarity, we need European collective action. And so I'm grateful that the Commission took up the work on the solidarity mechanism in the Critical Medicines Alliance. And I'm convinced indeed that in the long run, and maybe not that long run, the Critical Medicines Act will be an important asset. And we need an EU strategy on the health workforce, because the truth of the matter is that we cannot tackle also this one simply on our own. And should we ignore that, I think we would just have a kind of a zero-sum game where member states compete for each other's health workers. And now on crisis preparedness, I think it's true that our world is becoming increasingly unpredictable, let's simply say dangerous. And our health systems need to be prepared for whatever comes our way. You just take the scenario of mass flooding in Europe that was presented during the workshop on crisis preparedness, or what had been said in the panel about war and conflict. It's a stark reminder of the multidimensional impact also we may have of climate change on our health systems. From contaminated drinking water to new epidemics, I think we must work together in a fast and coordinated manner, and that means indeed streamlining our crisis governance and response systems. That is closely connected to the discussion on investment in health. We need indeed to invest to make our healthcare systems resilient. And notwithstanding, despite recent budget cuts, there are still multiple EU funding instruments available, but accessing these resources can be a challenge for national authorities. We must find better ways to align policy and funding instruments to ensure our investments are really making a difference. During our time together, we had 6 workshops, each one digging deep into solutions for our healthcare systems. The ideas and conclusions we've come up with will be crucial as we head into the formal or into the informal meeting of health ministers on the 23rd and the 24th of April. Ultimately, the insights shared in this room will feed into the Council conclusions on the future EU health agenda. I'm therefore confident that the work we've put in over the past couple of days will have a real impact on the future of healthcare policy in the EU. So, dear friends, let's keep pushing forward together. We've got big challenges ahead, but with the kind of commitment and energy I've seen here, I know we can make real progress. So thank you all for the hard work. Thank you for your insights, your dedication to the health and well-being of our fellow Europeans. Thank you so much. And I understand that there's something waiting still. Yeah.
Thank you, everyone. And very final thing, so lunch is now served outside. You'll be comforted to know that all normal facilities are now once again available, if I can put it that way. And for members of the press, there will be a press briefing starting at 1 in the room just to the side of the Secretariat.